A respiratory virus that typically shows up in colder months is resurfacing. Hospitals around the country and here in the metro are seeing a rise in RSV. It's a cold-like illness that can potentially be serious for babies and young children.
We're seeing a lot more viral transmission generally, and RSV, we're seeing a lot of that as well.
Respiratory syncytial virus, also known as RSV, has returned months before expected. Now cases of the cold-like virus, which can be serious for infants and the elderly, are on the rise.
This year, to see it in the summertime is very odd.
Dr. Krishnan Subramaniam is a pediatrician at Hennepin Healthcare. He says RSV typically emerges in colder months. Last winter was an anomaly.
This last respiratory season, we did not see much RSV, and we attributed much of that to our social distancing, to our mask wearing, to our hand washing, and to the distance being kept at schools and daycare centers.
For babies, a positive RSV diagnosis, he says, could lead to hospitalization.
It really attacks the small airways of our lungs, in particular the lungs of children, causes a lot of mucus production and a lot of irritation of those airways, and can make it very difficult for small children to breathe.
Symptoms to look out for: runny nose, cough, congestion, and fever.
Even though things are looking better from a COVID front, I would say those precautions that we were using can be really helpful, particularly if you're going to be around small kids, right? So washing your hands, keeping a little bit of distance, particularly if you have any illness.
Health experts say that they tend to see more wheezing with RSV than with COVID. If you notice your baby breathing faster than normal or having difficulty breathing, you should bring them to the hospital.
Well,